President Trump signed an executive order today laying out new recommendations for childhood vaccinations. CBS News obtained a draft of the order which would reorganize the childhood vaccine schedule, lessen the amount of recommended vaccines, and encourage parents to spread their children's shots across separate visits to the doctor. So I want to go live now to Dr. Richard Besser, the president and CEO of the Robert Wood Johnson Foundation. You're also the former acting director of the CDC and a prevention doctor. Quite the resume there, sir. Now, while this draft order doesn't explicitly mention autism, the president did repeatedly. Talk to us about this connection the president is making and this realignment of recommendations for childhood vaccinations.
Well, thanks, Liz. You know, in addition to what you said for my resume, I'm a general pediatrician and practiced pediatrics for more than 30 years and spent a lot of time talking with parents so that they could understand why their children were getting vaccines and the value that vaccines would have. And they could share in the decision as to whether to vaccinate their children. And it was never a big deal. What we're seeing now is the injection of politics into something that should be a very personal conversation between a parent and their child's doctor. And I would urge parents to ignore what the president is saying. He's weighing in on health issues that are not best addressed out of the Oval Office. He is injecting fear. He is injecting concern where there shouldn't be. His questions about autism have been addressed by study after study, and him lifting these up I'm not sure why he's doing this. The administration tried to change the vaccine schedule going around the established process back in January, and the court said, this isn't legal. You can't do that. Congress set up a system to ensure that the vaccines that are given to children and adults are safe and are effective. And once again, they're injecting politics into a place it shouldn't be.
You know, many parents, doctor, believe spacing out shots is a more gentler way to give out vaccines. Is there a benefit to it, or do you believe, no, the schedule now is the only way to administer vaccines?
Well, it's really important to explore that with your child's doctor. In terms of the effectiveness of the vaccines, there's no benefit in spacing them out. In terms of the soreness of a child's arm, I would often have a conversation with a parent and say, okay, your child is supposed to get these vaccines today. We can get it all over with today, or we can space them out and have you come back. The challenge with coming back for a lot of parents, that means taking another day off work, getting someone to watch their other children, making those arrangements. And so many people in our country don't have the ability to take off work without losing pay. In terms of the safety and effectiveness, there is no value in spacing them out. For a child who's had a bad time with one round of shots, it maybe had a fever and soreness that made it hard to sleep, you talk to parents and say, well, do you want to try spacing them out, see if it makes a difference? For some kids, though, that just means more, an extra day where they're having that sore arm and are feeling lousy. But there's room to work with parents on that, and it should be part of a shared decision making.
A lot of parents are getting their kids to go back to school. A lot of kids are already back in school, and you have to go get those physicals. And for many, that means vaccinations. A lot of parents are confused by these executive orders and conflicting their information that they're getting from people like yourself, but then also people within the administration. What does it mean for parents? What advice would you give to parents who are confused about what to do?
Yeah. Well, if you're fortunate to have a doctor, a nurse, a pharmacist that you have a trusted relationship with, talk to them, listen to their advice. What do they say to do? What do they do for their children? And I would have the conversation. I made sure that my kids were vaccinated fully and on time, because every day they were fully vaccinated meant one fewer day that they were at risk for a disease that could cause real harm. And that's a conversation that's worth having. This political noise, I'm not sure why they're coming at it. I had thought it might slow down before the midterm elections, but we have, as our Secretary of Health, one of the nation's leading anti-vaccine advocates, and it seems like he will not stop until he has his way. And that goes against the science. It goes against the safety and the health and the protection of our children.
Dr. Besser, great to be with you. Thanks so much.
Thank you.
Let's go ahead now and go to CBS News medical contributor Dr. Céline Gounder, who has also been listening. Doctor, give us your thoughts on this order.
Right. So I think you did a great job of summarizing the top line, Lindsay. But I think a few things I want to focus in on. So first of all, is splitting up the MMR vaccine even possible? Merck stopped producing the standalone measles, mumps, and rubella vaccines in 2009. There is no currently licensed version in this country. No company has said it's building one, and the order only takes effect once those products exist. Mumps vaccination fell in Japan when it split up its vaccine in the 1990s to about a third of kids. And doctors documented hundreds of kids in Japan who lost their hearing as a result of mumps infection. One of the other things that was brought up here was spacing shots out. A lot of parents think that's gentler. Well, I don't know if I would agree with that. It means you have that many more injections, but about 4 in 10 parents believe that spacing shots out is a gentler approach. Researchers in Oregon followed almost 100,000 children to see how this worked out, and the ones whose parents spread the shots out more made more trips to the doctor and got fewer vaccines. So every extra visit is one somebody has to take time off work for or away from other activities. Finally, what should parents do based on what we're hearing now? As of right now, this does not change the vaccination recommendations out of the CDC. A federal judge blocked the last attempt to cut the schedule back in March, and that ruling currently stands. So your pediatrician is still working from the same schedule as yesterday. And if you're unsure, ask your pediatrician which shots your child is due for and why.
I think it's also important, Doctor, to mention that there's no evidence showing this causality right now, if you can sort of jump into the science behind that. But even just having an announcement like this, an event like this, an executive order like this, changing a policy like this, it could lead people to thinking otherwise, to thinking that these vaccines are not safe for their children.
And this is a very real concern. I want to be very clear. Vaccines do not cause autism. This has been tested in more than 1 million kids across multiple countries and decades. No study has found an increased risk. And, right now, I think we have to unfortunately turn to institutions like the American Academy of Pediatrics, the National Academies, the Infectious Diseases Society of America, and others in the absence of real scientific leadership at the CDC. Some of the evidence I can cite for this, so there was a Danish study that looked at over 600,000 children and found that the autism rate in vaccinated kids was, if anything, lower than in unvaccinated kids. There was also an analysis looking at 1.25 million children, finding no association between vaccines and autism, and none for MMR or thimerosal, which is a mercury-based preservative, no association with autism. There's also been a study of almost 100,000 American kids, which included nearly 2,000 who had an older sibling with autism. If a vaccine triggered autism in a genetically vulnerable child, this is where you would see that risk play out. The risk in the younger sibling was no higher. We took thimerosal, the mercury preservative, out of routine childhood vaccines around 2000. In California, the autism diagnoses kept rising every single quarter for the next 6 years. If thimerosal were the cause, the rates should have fallen, and they did not. And then finally, in 2004, the Institute of Medicine concluded that the evidence favors rejection of a causal relationship between the MMR vaccine and autism.
The Health and Human Services Secretary, Robert F. Kennedy Jr., is not a doctor. He's not a scientist. He's an environmental lawyer. But he is at the forefront of this Make America Healthy Again movement. There are a lot of people who are looking to him to get preservatives out of our food, dyes out of our food, to make food healthier, to remove some of these environmental factors. He had just mentioned something happened around 1989 where these rates started increasing. There must be some kind of environmental toxin or group of toxins. Has this already been studied? Is it worth looking at this more carefully? I don't want to completely people who are concerned and who are listening to this, and it's hitting on something that they believe in, that they think, not to discount that, but also what has been proven already and what should we be investing in?
And look, I understand the concern. We do need to get to the bottom of why we are seeing increasing rates. The estimates are that about 80% of the increase we've seen is attributable to better diagnosis, but there is still some proportion of that that may be not just better diagnosis, but other factors. The challenge here is you cannot prove a negative. You cannot prove, for example, that God does not exist. Similarly, you cannot prove with 100% certainty that vaccines do not cause autism. However, with all of the evidence we have, I feel very confident in saying that you do not have to worry about that risk. Now, there is a lot of research that needs to be done on what causes autism, how to better help families who have children with autism, how do you potentially treat or prevent autism. Some of the understudied potential risk factors include genetics, which we think is by far and away the most important predictor here. Other factors like, for example, advanced paternal age, the advanced age of a father at the time that he and his partner conceive. Some of the other evidence here that I also hadn't cited yet, in 2013, the Institute of Medicine, which was actually a study or a report that Secretary Kennedy cited in his interview with Dana Bash on CNN about a week ago, he misquoted that. That 2013 Institute of Medicine review found 32 different studies on immunization and developmental disorders. Also found no evidence that the childhood vaccination schedule in this country is unsafe. And that same report also says that running placebo-controlled randomized clinical trials of vaccines at this stage would be unethical, because then you would be randomizing a child to no vaccines, knowingly understanding that you would be leaving them unprotected against infections like measles and whooping cough.
The president often says that the USA schedule is too long, that there are too many vaccines. The secretary said the word 94, that some kids are getting 94 jabs. Now, it's important to note that a lot of what's included in the numbers that they're giving include annual influenza, annual COVID-19 shots. And I don't know the exact number. You can tell me what the average number is if you have that stat. But he often compares, as this executive order does, our doses and dosing schedule to European countries. Why is that?
Well, that's actually misleading. Denmark, which is the country that President Trump and Secretary Kennedy repeatedly compare the U.S. Childhood vaccination schedule to, Denmark is the outlier. Denmark covers 10 different infectious diseases. The average across 38 different countries is 14. South Korea and Brazil cover 18, Greece 17. We are at about 17 or 18, depending on how you interpret. And the Danish scientists have actually said they need to be covering more vaccines, recommending more vaccines, including, for example, hepatitis B.
Overall, for anybody who might just be joining us, who is listening, and they'll see the headlines about, an updated vaccine schedule and new recommendations, new guidelines, what is your top line for parents?
I think the top line here is that vaccines do not cause autism. There has been, this is one of the most tested questions in all of medicine. There are other potential risk factors or causes of autism that have not been adequately studied. And really, that's where we should be focusing taxpayer money if we want a real answer to the question of why are we seeing an increase in autism diagnoses.
Okay. Dr. Céline Gounder, thank you so much. For now, we are going to keep monitoring what is happening here in the Oval Office. And if the president starts to take questions, we will bring you back here. But for now, we are going to take a quick break.
Dr. LaPook, please help us understand what this does, what it doesn't do, and what are the risks implicit?
Well, I think the first thing that strikes a lot of us is that this is somebody getting up there and making a proclamation, but as my math teacher used to say, show me your homework. So the usual procedure is that there's a meeting by the Advisory Committee for Immunization Practices. It's over a 2 or 3 day period. It's boring as anything, Major. I've sat through them, and all the stakeholders there, researchers and pharma and the public. And after a few days, they vote, committee votes, and they make a recommendation, which then goes to the CDC director, who can accept it or reject it. This just bypasses that. So it's not the way usually things are done. It doesn't give the community of doctors and other researchers the ability to say, okay, how did you come to that conclusion?
But the White House kept saying today, the president and those standing with him in the Oval Office, that this is the result of gold standard scientific research, that they've discovered new things that were undiscovered before and risks that were not fully appreciated before. Is any of that true?
Well, again, show us your homework. You know, you have to keep an open mind. We don't know everything. But as Ed said in the piece, you know, there have been extensive research and studies. More than 1 million kids were involved in one study in Denmark showing no association between vaccines and autism. And, you know, one thing especially struck me that the president said today. He said, nothing bad can happen. And I'll give you an example of something that potentially could happen that's bad. There is a real misconception about hepatitis B vaccine, which now is, they're saying, okay, you don't, that's not recommended to be given at birth. Because the assumption, which is not correct, is that you can only get hepatitis B if you're an infant from an infected mother. In fact, you can get it from close contact, from contact by the fluids of a caregiver, of somebody who's taking care of you. It turns out that more than 600, actually more than 800,000 Americans have hepatitis B, chronic hepatitis B, and about half of them don't know it. And of the people who do know it, half of them don't know how they got it. So you could, I'm not trying to be scare people, but you could have a caregiver, for example, who's infected with hepatitis B, they wouldn't know it, and they can infect a newborn. Now, if a newborn gets infected with hepatitis B, there's a 90% chance that that baby will go on to have chronic hepatitis B. And I'm a gastroenterologist, and I've seen what happens to that, including life-threatening things, liver failure, and even severe gastrointestinal bleeding. I've been by the bedside of a patient with hepatitis B, in fact, many of them who have actually just died because of extensive bleeding we couldn't keep up with. So the thought that like nothing bad can happen, I think that's not true.
Ed O'Keefe mentioned Senator Bill Cassidy, who's a physician, and an ex-post he put out about this. Reading also from that, he says, Dr. Cassidy, Senator Cassidy, breaking up vaccines will mean children will have to get more shots to get the same protection, not fewer shots. It will increase hesitancy and make children less safe. Do you agree or disagree with that?
I actually do agree based on what the American Academy of Pediatrics is saying and other people. And you always have to ask yourself when there's a new recommendation, what's the new data that came out that made them say, okay, now we used to do this, now we're going to do that. Show us your homework.
One last thing, Dr. LaPook, just practically. The president was asked about this, he had no answer. This means more visits, which means more copays, which means more logistical hassles for parents, for children, and for pediatricians and their staff. That's a real issue, is it not?
It's a real issue. And when you think where we are in kind of limbo, where you have the American Academy of Pediatrics making one recommendation, the President of the United States making another recommendation, where does that leave parents? Well, I would say if there ever was a time to talk to your caregiver, it's now. But again, who's going to pay for those visits and the extra visits you mentioned?
Dr. Jon LaPook, always a pleasure, sir. Thank you.